Deserved to be taken away. But before he had a chance to wave the white flag, before he had a chance to lift his hands up and walk away like a man, he was dropped like before 41 by 4 gave him the chance to stand. Knew he was scared, might have even peed his pants but couldn't feel it. Couldn't feel his hands over his face, just knew that's where they were supposed to be. Cause he could have been crying like a baby, 41 by 4 you see. First bullet must have let his soul fly. Like suicide, it jumped from his body only to be hit by shots that would shock the body after. His soul led dead first to begin the 41 by 4 disaster. Now look what we got here. No reason to call no medic. Don't begin no CPR, cause there's more blood on the floor than what's in his body. Just pick him up, put him in a black bag, zip his ass up and ship him off to the morgue and let them determine the cause of death. Or are you sure 41 by 4 has put an innocent man to rest?
Good afternoon. Welcome to Path for Change. My name is Arthur Butler. I'm the Executive Director for the Schenectady County Human Rights Commission. Thank you for tuning in. Thank you for your time. Thank you for being a part of this very important celebration, celebrating the work and life of Dr. Martin Luther King. We have for you today individuals who emulate the life that Dr. King dreamed about. So we want to invite you to sit back, open your mind, open your ear, and enjoy what we have for you today.
So take a good look at my face. Mental health has become my twin. She sits with me and interrupts my morning meditation because she says I work better in chaos. So I start my day with fake smiles trying to catch up with myself. But by the time the day is over, I've already recasted myself in tomorrow's role of trying to be a quote-unquote better me. You see, I am my own glass ceiling. But I keep falling through the top instead of shattering hurtful feelings on the way up. Like many women, I'm stuck in abusive memories. I have an addiction to physical abuse or pretending to know what self-love looks like on my skin. I am broken alive. Breathing in agitation, wishing it was my blessing. My history supersedes my outlook on my future. But I am standing here smiling through hurt, laughing in agony, and building others up while my blood boils in pain. Because that's what women do. We stop breathing so others can live. And you pretend to see me in hopes that my anger doesn't erupt in your veins. When all I really want to do is talk through my pain. I'm pleading the next time you see my discomfort through my swag. Look at me and take a good look at my face. You see my smile looks out of place. If you look closer, it's easy to trace the tracks of my tears.
It's important that we come together. It's important that we see eye to eye. It's important that we have conversations. It's important to move from the dream into reality. It's important because our lives, our livelihood, our existence depend upon it.
For middle-class poor standing on the corner, brown-skinned brothers. They are in different suits for going out into the world and being seen as one. Who's destroying the black man? Extra, extra, read all about it. Black man on trial for being black. He was caught with an afro, books, and a Fight the Power t-shirt. Charged with carrying a concealed weapon of being a future leader. The punishment? His character ripped apart on the local news and sentenced to be 3/5 of a man. After his release, he tried to go back out into the public, but his rep was labeled with alarms that went off at the sight of him trying to redeem himself. Emergency, emergency, it's a code red. Black tried to re-enter society and build up his community. He was caught holding a conference with other positive blacks that looked exactly like him. Called the 1786 authorities to shut them down. That wasn't a part of the 40 acres and a mule conspiracy theory to brush black off. Who told black he could excel in power and control? That's why they called him 3/5 of a man. Extra, extra, read all about it. Black man found dead in the middle of the ghetto. The cause of death? A 2023 lynching. He was found with a noose around his neck and S IHP branded on the top of his forehead because they told that to stay in his place. Damn, Black, we done lost another one.
Maybe I'm going to get into a little trouble of my own by creating a space to have some good trouble or make some good trouble. We're going to honor those who fought so hard for people like me to have a vote, who worked hard to make sure that we had education, who fought hard to make sure that our rights were as important as the next person's right. So we're going to hear from our elected officials. And they'll tell you why it's important to vote, why it's important to be a part of, why it's important to save those things which those who we stand on their shoulders so proudly fought so hard for. It's the things that connect us that makes us one versus the things that tear us apart. Those things divide us.
Good day, everyone. Good day, Schenectady. Welcome to another celebration of Dr. Martin Luther King Jr. Day, in which we in Schenectady County, by the Human Rights Commission, takes time out to remember Dr. Martin Luther King Jr. and all of his accomplishments that he has done. On behalf of Tony Jasinski, Chair of the Legislature, and all the legislatures in Schenectady County, we welcome you. My name is Philip Fields, and I'm the Deputy Chair and also a Commissioner on the Human Rights Commission. Today, I would like to thank Dr. Andre for being here as one who will present to us an understanding of healthcare and what we can do in our community. You know, as we deal with Arthur Butler, who is the Executive Director, and those that came up with the title, Paths to Change, this day will be an interesting day in which we can educate ourselves and understand the need for healthcare change in Schenectady County. I would also like to thank the Mistress of Ceremonies, Cameron Robinson, for her participation here today, and all that is the special artists that are doing their job. Thank you. And for the listening audience, we just would like to say to you that in Schenectady County, we're also trying to do our path in terms of giving health care to those that are in need. When Ellis Hospital decided to change its service for dental care in Schenectady County, we, the county, along with Hometown Healthcare, decided to provide dental services for those in need, the underserved, right here in Schenectady, in our city, on the corner of State and Brandywine Street. So they're building a new dental facility there. In that particular facility, it costs about $7.5 million to construct. The county provided $4 million to help this service to make it available for our residents. 19,000 people in Schenectady County will be benefiting by this particular program. So as we live in this particular city and this particular county, and the title of the city is, Schenectady, a city on a hill, it shines forth its light. I hope that Dr. Andre would give us an enlightening moment here to teach us, make us understand, both intellectually, physically, emotionally, spiritually, that we could understand what is needed in our county. So thank you all for participating. Thank you all for watching, and welcome again to another day of celebration for Dr. Martin Luther King Day. Thank you.
Thank you for inviting me to join you as part of the Schenectady County Human Rights Commission Martin Luther King Jr. Day Observation Celebration. I do want to acknowledge and thank Arthur Butler, Chair of the Legislature Tony Jasinski, and Cameron Robinson. I also want to take a moment to welcome Dr. Craig Andrade, Paulette Lunn, and Freedom McBride, and all of the community leaders and advocates joining today. This year is the 40th anniversary since the law was first signed marking Martin Luther King Jr. Day as a federal holiday. Today, 40 years later, the nation observes, celebrates, and acts on this day. We serve our communities, we recognize the needs of our community, and plan for the future. On this day, we remember Reverend Martin Luther King Jr. and celebrate his extraordinary impact on our nation and in the hearts of the American people. Through his profound words and tenacity of spirit, he was able to help others see his dream of a better world. Now and always, we honor Dr. King by pledging to never lose sight of his dream and to keep working to achieve his lifelong commitment of peace, justice, and certainly equality for all. I am excited that this year we are focusing on healthcare as a human right. I think this is very fitting since Dr. King recognized the deep injustice in health. Dr. King's legacy reminds us that we must push forward and be steadfast and resilient in our fight for justice, including the human right to health care. In the richest country in the history of the world, no person should be denied health care due to cost. That is the lens through which I look at this issue, and I am reminded by Dr. King's message of persistence. We've made significant strides in that regard during my time in Congress, but there is still a long way to go. Addressing the health needs of Americans is one of my top priorities. I am fighting every day alongside my colleagues in the House to increase access to critical treatments and supplies. The Affordable Care Act marked a major step forward toward the promise of affordable, quality health care for all. I supported this legislation because it ended discrimination in the health insurance marketplace against individuals with pre-existing conditions and allowed more than 20 million previously uninsured individuals to receive health care for the first time. I have always said that the ACA was a first step and that we need to go further, which is why I've supported proposals like Medicare for All. In fact, the Medicare for All legislation was the first bill I ever co-sponsored in Congress. I strongly support Medicare for All because I believe in the richest nation in the history of the earth that health care should be a fundamental right for all. While I'm a strong supporter of Medicare for All, I have also supported other paths forward to reduce costs, increase the quality of health care, and insure more people. For example, I support a proposal by my colleague Brian Higgins to allow individuals to buy into Medicare at age 55, which would provide an affordable option for individuals while improving the fiscal strength of both Medicare and the health insurance exchanges. I am also supportive of a plan to provide a public option in the health insurance marketplaces to allow for competition to exist within and amongst the private plans. We need to take any and every step available to move toward universal quality health care for all. It's the smart thing to do, and it's the right thing to do. Right now, I am pleased that we're able to beef up the Affordable Care Act tax credits through the Inflation Reduction Act to ensure families are able to access more affordable health insurance. And we've also allowed Medicare to negotiate drug prices for the first time, an innovation that will help lower drug costs across the board for American consumers. With the Inflation Reduction Act, we've finally allowed the Medicare program to negotiate directly with drug manufacturers so that we can secure better prices for the American people. The Inflation Reduction Act also creates a new $2,000 out-of-pocket limit on prescription drug costs, adding an important protection for Medicare beneficiaries. The Inflation Reduction Act also caps the price of insulin at $35 a month for Medicare beneficiaries. Unfortunately, Republicans stripped a provision from the bill that would have guaranteed insulin for no more than $35 per month for all Americans. I'll keep fighting for this provision and to ensure that all Americans have access to the lower prices we are able to negotiate. The COVID-19 pandemic has greatly exacerbated issues of equity in healthcare services and impacts. While the overdose crisis predates the COVID-19 pandemic, it has further impacted individuals struggling with or at risk for substance use disorders. In Congress, I serve as co-chair of the Addiction Treatment and Recovery Caucus and as a member of the Mental Health Caucus, and have tried to focus attention on this problem. Now, more than ever, this disease of despair deserves a response rooted, deeply rooted in hope. That's why I'm working hard to ensure that the needs of those struggling with substance use are fully addressed. Last year, we took a major step forward in addressing our opioid epidemic by passing my Mainstreaming Addiction Treatment Act into law. This eliminates the outdated barriers that prevent more people in need from having access to buprenorphine, a life-saving drug. I've worked on this legislation for years and was thrilled to have it advance with a strong bipartisan majority. By passing this law, we are vastly expanding access to addiction medicine and moving us toward a system of treatment on demand for those struggling with addiction. I'll continue to focus on knocking out every single barrier to addiction treatment so that when an individual struggling with addiction reaches out for help, we have a medical system ready to welcome them with open arms. I'm also proud of the bipartisan work done on the Medicaid Reentry Act, which focuses on improving mental health and substance care for justice-involved individuals by allowing states to restart Medicaid benefits for the incarcerated individuals 30 days prior to release to ensure a smoother transition back into the community. This will help to better ensure those transitioning will have immediate access to critical services, including mental health support, addiction treatment, and COVID testing. We also must continue to address the enormous loss COVID has inflicted on us. Worldwide, more than 10.5 million children have lost one or both parents or primary caretakers due to COVID. For those of us who have lost loved ones, we also are dealing with other lingering effects of the pandemic, including mental health issues, long COVID, and more. For all of these problems, the underserved and less privileged are those individuals who disproportionately bear the brunt of these burdens, yet often have the least access to services and essential treatments. I ask that you join me in fighting for more fair laws that recognize that healthcare is indeed a human right. I know that many of you are committed to this and are working in our communities to ensure that all people have access to quality and affordable health care. I thank each and everyone listening for their recognition of healthcare as a human right and for your commitment to social justice. Together, let's remember a true hero and let us honor the tremendous work and the personality of Dr. King by pledging to never lose sight of his dream and to keep working to achieve his lifelong commitment of peace, justice, and equality for all. Thank you, one and all, and have a great moment of commemoration of a figure that has touched all American lives.
So I don't know about you, but I am excited, I'm inspired, I am encouraged to be a better me in just what I've heard so far. So I want to thank our elected officials. I want to thank the amazing performances that has been put together for you today. We're going to come up now to our keynote address by Dr. Craig Armagad. And we have a mistress of ceremonies, Cameron Robinson, two exceptional, dynamic individuals. You'll want to hear them.
Thank you, Arthur. I am really pleased to be here. Thank you for inviting me, and welcome everyone. Good Sunday afternoon, and I wish you a happy, joyous Martin Luther King Day. I am speaking to you from Boston, and I'm glad to bring this conversation forward. I will start by sharing a PowerPoint slide that really is meant to provide a setting for our conversation following this presentation. It is meant to provide all of you with a grounding of information that helps us all remember and stay focused on the fact that what we are managing in the lives of all of who are watching this and all of the people that we care about around us in our circles live within a circle of structural racism that harms all of us, no matter how we identify. We often are encouraged to focus on individual and interpersonal racism and ways that otherize people from an interpersonal perspective across identities, race, sex, immigration status, language, and so forth, otherwise able and disability. And in reality, those things can cause harm, but what is mostly harmful is the structural elements that we live with and have inherited from the time when we first started enslaving people from Africa in 1816. So I want 1618 rather. I'm sorry. I want to first start with this PowerPoint. They call this a racial equity in the groundwater, an allegory around racial inequity. And this is the path to what Dr. King would call a beloved community. So we'll spend some time just with a little bit of more of an introduction and to kind of create our container here. As you listen to the things and look at the things that I share on my slide deck, I want to encourage to make sure we create space for people to stay present, to engage and integrate this information in a meaningful way and not get disrupted by the challenging information that sometimes often can occur when it comes to discussions around race, in particular because our community, our society has discouraged this conversation up until just recently. We'll talk a little bit about power and privilege and positionality. And then in our conversation with Cameron and myself, we'll go into what does this mean about our practice and what it means for us in the world and particularly where you are in your own communities. I first want to provide some acknowledgments that a lot of what I'm sharing today is what I've learned over my years as a practitioner, in particular working with advocates that have helped me understand the untold or less told history of the United States and what it means and how it's created this structural racism that we'll be talking about. So I want to acknowledge the Racial Equity Institute in North Carolina. They have been instrumental in helping me and many of my colleagues understand what we didn't understand a long time ago. The Human Impact Partners in California and the colleagues of both these institutions, Bay Love, Abigail Ortiz, Nashira Burrell, Meenakshi Veram Agrawal, all have been great educators, leaders, and mentors for me in this conversation and in all this information. And so I describe myself as Craig Andrade, my mother's given name. I go by pronouns he, him, and his, and I identify as a Black Cape Verdean, third-generation Cape Verdean cisgender man. I would encourage you all to kind of think about how you identify in these ways and many others, because it is relevant in terms of how we bring this conversation forward and how we present into the world and how that relates to the dynamics that we live with within this environment and structural racism that is all around us. To set a container, I want to encourage us to recognize that, as I mentioned, the discussions around race and our less told history in the United States and what it means for all the things we do, where we work, where we play, where we love and pray, all of the things that help us create and be all of who we want to be, or undermine who we want to be and what our potential is, comes from our identities and how other people identify with us. So when we talk about this, let's create this space that allows for adequate learning and allows for us to know that we all have good intentions, that I have intentions of really bringing good information that is factually based, and is less anything other just the history that we've lived with and what it's resulted in. I ask you to watch your inner judge, in that sometimes we can be harsher critics on ourselves than anyone else. And if this information is in any way new to you, if it's upsetting, if it's challenging, be kind with yourself and know that that's not unusual because of where we've lived and how societies have discouraged these kinds of conversations. We won't, unfortunately, have a ability to have a conversation with you as an audience, but make sure that when you share these informations with others, allow for a broad conversations where people can share their perspective and you can do the same. And then finally, do whatever you can to take care of yourself. Again, if this is at all emotionally upsetting or challenging, just be kind with yourself and do whatever you need to take care of yourself. I will, in this conversation, identify ways that racial inequity persists in every system across organizations and the country without exception. Explain the socioeconomic differences don't explain away racial inequity. Recognize that inequities are caused by systems, regardless of how people's culture or behavior manifest. I will distinguish the difference between legalistic kind of version of diversity, equity, inclusion, and justice, and talk about the culture, focusing mainly on that in significant ways. And then consider ways that structural racism, power, and privilege, what that means for you personally and professionally. As you watch this conversation, as I mentioned, I encourage you to just continue to take a little bit of a emotional temperature, an internal temperature of yourself. We want to stay in that red line in between these two black bars, the optimal arousal, where you're able to listen to me without being distracted, take that in and integrate it, not being hyper aroused where you're getting anxious, angry, upset, or anything like that, or hypo-aroused where you're numbing yourself and shutting down and not able to take this in. Just by making sure you take that temperature, and I'll encourage that throughout this conversation, I will you can find ways to take a deep breath, stand up, move around, and sit back down and come back and continue to be engaged in this conversation. Again, in part, it's important to kind of acknowledge these challenges can arise when you're having information that is new and to some degree upsetting. This quote by Resmaa Menakem is a quote by this author who's also a therapist. He's a therapist, an African-American man that had and continues to do therapy for communities when harm had happened after at the hands of police across the country. He often was one of the people that were working with those communities directly harmed, those communities of color, Black and otherwise. He also had opportunity to meet with white populations and understand that they may be in the midst of some kind of trauma from a different vantage point. And interestingly enough, it also had therapy conversations with police, recognizing the challenge that the unique perspective they have in the midst of all of these different things. And so he speaks to this idea of trusting the genius of our body, self-settling on the edge of discomfort, recognizes that while you're in the midst of this discomfort, staying self-settled and being persistent in that and staying and persisting in these conversations allow for us to move and make the change that we want to see. It is part of the reason that the leaders that we have gotten us to this point and the work that we still have in front of us. Now, I don't usually read a big slide like this, but this language is very important. I started this work about 10 years ago when I was working at the Massachusetts Department of Public Health. I was the director of the Bureau of Family Health and Nutrition, mostly maternal and child health focused. I was the second bureau director of color in the Massachusetts Department of Public Health. The oldest Department of Public Health in the country by evidence of the first commissioner was Paul Revere. So I am was the second bureau director of color to be in this department in 2000s. And so this says to where we have come from. And as we watched those Black and brown people being harmed at the hands of police, we recognized that we needed to look beyond our public health lens and bring a racial equity lens to our work. And this is when we started to dig into what is that untold history? What does that mean for a public health practice? What does it mean for a partnership with community? And so as we did that work, we developed a statement of why we focus on racial equity. And here it is. The impact of structural racism, the public policy, institutional practices, social norms that together maintain racial hierarchies is often overlooked and unacknowledged. Yet it is pervasive and unmistakably harmful to everyone. The social marginalization and inequities that structural racism cultivate in housing, education, employment, the built and social environment, and healthcare are felt across generations, most acutely in communities of color. The Bureau of Family Health and Nutrition recognized that systems of oppression need to be acknowledged and repaired by entities that help create them. The Bureau is committed to improving the quality of life for all Commonwealth residents while eliminating the marginalization and inequities that threaten the lives of communities of color who are disproportionately affected by conditions leading to poor health outcomes. This was something that we wanted to plant a flag in and help our community understand why we do the work in the way that we do it and why this really matters and why it is now the foundation of what we do at the Department of Public Health. It started with one bureau that I was part of, and then I took over this Bureau of Family Health and Nutrition. We joined that work, and then we actually spread it throughout the department. So the whole department, as well as the Secretariat of Health and Human Services in Massachusetts, has taken on this equity work in a way that helps us make sure it's the foundation of our practice in supporting our community members. By way of definitions, I want to just kind of bring some things forward, and you may have seen this kind of infographic before, but it's important to make sure that everybody is in the same place and finding a common ground for understanding of definitions. When we talk about equity, it is not the same thing as equality, which has long, for decades, and perhaps centuries, been the kind of gold standard of what the ideal is in our society. Equity means sameness, and you see here, if everybody gets the same bike, that doesn't mean everybody gets what they need. Equity is meant to bring what people need and start where people are so that everybody can be the best of who they can be. Racial justice is not diversity. Diversity is really speaking about numbers and variety. Racial justice is not equality. Equality is sameness, as I mentioned earlier. And finally, racial justice is equity. Equity meaning fairness and justice. Just one of many definitions for racism, a system of advantage based on race. This is by one author, but again, there are many others. But this system of advantage of some over others based on race is the critical element. And now, just to kind of speak with the why talk about race as opposed to all kinds of things like sex and able-bodiedness and other kinds of things, three elements it's important to acknowledge. We lead explicitly, though not exclusively, with race because racial inequities persist in every system across the country without exception. We can't find one example of a system where there are no racial disparities in outcomes: health, education, criminal justice, employment, and so on. When we look within other dimensions of identity, income, gender, sexuality, education, ability, age, citizenship, geography, there are inequities based on race in all of them. Knowing this helps us take a more intersectional approach while always naming the role that race plays in people's experience and outcomes. Inflaming racial tension has been a deliberate political strategy by those seeking to maintain their own power through subtle dog whistles, coded references, and more. Recently, and again, overt racist statements, while wealthy, special, and corporate interests have successfully divided low-income people of color from low-income whites, preventing those groups from joining forces and building power. So to clarify, we're going to be focusing almost exclusively on structural racism. That isn't to say that there aren't other types of racism. We have internalized racism, we have interpersonal racism, which in particular the media tends to focus on. We all often hear, if we just get rid of this one bad apple, if we just send that person to a training, or if we just find ways to make sure that person has a better understanding of what harm they're causing, will make a difference. We know that there is harm that is done by interpersonal racist engagements, but at the same time, the broad overarching harm is done in a population-based across society through institutional and particularly structural racism. That's where we'll focus today. So we have this timeline, and the timeline of white supremacy. We use that term in a deliberate way because the system of structural racism is trying to make sure white culture is the supreme culture, meaning we have white on top and black on the bottom. We have all those other racial groups in the middle, and the darker you are, the more negative the outcomes in this society of structural racism. The lighter or whiter you are, the less negative outcomes you have. And I encourage you, if you take anything away from that, you'll notice that. And I encourage you to test that out, to look at the data, to kind of understand whether this agrees with what you see and what the history has shown, and whether the data bears out. This timeline is meant to address the kind of consideration that has been said that slavery is long gone. We had a black president finally. We're a post-racial society. Why are we talking about all this stuff still? We look at the timeline here in 1619 when the first slaves were brought in ships from Africa over to this new land in 1619. Slavery didn't quite end until 1865, when we started that 30 years of Reconstruction, where we undid after the Emancipation Proclamation, after the Civil War, and actually did some reconstruction, revolutionary change, where during that 30 periods of time, there were 2,000 previously enslaved people that were in federal government and local government and state government, elected in a way that moved towards a more equal, equitable union, where we were building schools for people who had previously been enslaved, and on and on and on. But in that short time, after the assassination of Lincoln and the vice president, who was a Southern slave owner, took over, we slowly but surely loosened the restrictions of the previous way of treating those previously enslaved. And while we had laws that were on the books to change and make for a more equitable union, we had these Jim Crow laws that were used in the South and elsewhere to undermine those rules. So, for example, we were allowing for all kinds of elimination of voting rights, elimination of work, elimination, imprisoning people in all kinds of different ways, whether if they didn't have a job, if they were just loitering, if they didn't cross the street when a white person was coming near them, if they looked the wrong way, they could be put in jail and then through convict leasing, be loaned out for slavery by another name. We also, at that same time, had disenfranchised it through white terrorism, including the Ku Klux Klan, and lynching, and broad spectrums of murder and injury throughout, examples of riots that were undermining communities that were growing within the Black population. Within that time, we saw the New Deal from FDR that was providing the GI Bill and all those kinds of things, housing opportunities that were moving forward in the late 50s and 60s, and those were not in large ways extended to the Negro populations, the African American populations, because of a deal that FDR did with the southern states to be sure that they didn't extend those to mostly low educated workers and things like that. So we slowly but surely made it so that we weren't able as a society of people of color and Black in particular to create wealth. And the war on drugs, we started to, through the Nixon administration, the Reagan administration, and forward, to over police our communities. Redlining allowed for us to be concentrated in certain areas and not have wealth in our property, not get similar kinds of loans for housing, and ultimately kind of segregate us in all kinds of different ways. So that brings us all the way up to the present day, and you see the timeline is very, very short when you look at it in this way. So I want to bring an analogy for the groundwater that I mentioned earlier in the title. So imagine you're outside of a cabin that you're vacationing on, and you come out and you see one fish belly up. This groundwater metaphor is speaking about racism. And if you saw one person or one fish belly up, you would think, well, there must be something wrong with that particular fish. In this case, we use a fish as an analogy for people. We would think, well, maybe they ate something bad, they had something that was somewhat poisonous, they somehow are sick. We'd look at the fish. And we've become very good at looking at individuals and fixing things with individuals. Fixing fish we're really good at. So in this analogy, we have a fish in the water, one fish belly up, and we are focused on an individual. But if we came out the next morning of that cabin and 50% of those fish were belly up, we would then have to wonder, this can't be just an individual fish problem. There must be something with what the environment of where those fish are. So we'd likely look at the water and wonder whether there's some kind of poison in the water, some kind of contaminant that is particularly vulnerable for a certain subset of the fish in this pond, and start to do those kinds of tests, look at the environment. If you came out the third day and noticed that you were surrounded by multiple ponds, so you might say that this is the banking pond, this is the housing lake, this is the education lake, this is the criminal justice lake, this is the healthcare lake, and in all these lakes, 50%, half the fish were belly up. Then you would have to say, well, if I drain the water in every one of these lakes, because water, most of the water on this planet is in the groundwater and the parts that we can't see, we drain these lakes of whatever we thought was poisoning it, we would think that that water would just re-rise through the groundwater and fill the lakes back up with the same poisonous water. In this case, we're talking about the poison being racism. So the banking lake, the criminal justice lake, the housing lake, the education lake, the healthcare lake, they're all part of the same system of groundwater poisoned by racism. And we can't just look at the water. We can't just look at that. We have to look at the groundwater and understand it's a system that we have to address, not just individual fish or just individual environments like the school or the bank or the prison or the hospital. We have to look at the whole system that every system is infected by. So the metaphor speaks to racial inequity, looks the same across systems. Social economic differences do not explain racial inequity. Inequities are caused by systems regardless of people's culture. Racial inequity, is a problem of bad policy, not bad people, as Dr. Ibram Kendi would speak to in How to Be an Anti-Racist. The quote is, "The history of racist ideas is a history of powerful policymakers erecting racist policies out of self-interest, then producing racist ideas to defend and rationalize those inequities, inequitable effects of these policies, while everyday people consume these ideas, which in turn sparks ignorance and hate." When we talk about that analogy, we recognize also that in these different lakes or different systems, we call them different names. In the welfare system for child welfare, we call disproportionality. In health, we say health disparities. In education, we say achievement gap, housing discrimination in housing, and so forth. By calling it different names, we make it hard to recognize that this is one system of racism, that just by calling it a different name, we distract us by looking at it in the same way and collaborating in a way that allows us to dismantle that system that affects every system. So I'm going to now just kind of ask you to take that temperature, that look at that window of tolerance that I showed you, and see what your inner environment is looking like. If you're feeling a little bit hyper disoriented, hyper dysregulated, take a deep breath. If you're kind of numbing yourself out, again, stand up, walk around, look around, just make sure that you're staying present. This is tough information. So I'm going to move forward and show you some data that kind of highlights and kind of further emphasizes the validity of this groundwater approach, recognizing that it is a systemic issue, not individual community challenges. So this is called a relative rate, and we're examining the rate of exposure of a negative outcome for Black populations versus white populations. In this slide, looking at how much risk of negative outcomes for Black populations in the blue line and blue dots versus white populations. And in this example, you see on the x-axis, we have health, education, health including death from diabetes, infant death, education including discipline and non-proficiency in reading and in math. We have criminal justice, arrests and juvenile commitment, and child protection services. On this axis, you see taking out of the home, you see housing, denial loans, and low opportunities in areas. And in economics, you see unemployment and childhood. And you see here in Massachusetts, for the example for that state, whites have equal low chance of a negative outcome as compared to the Black populations, where up to 7 times the rate of a negative outcome compared to white populations. That doesn't say that whites don't have issues with diabetes or other types of negative health, or challenges with discipline and education, or in criminal justice, or in housing or education. It's saying when whites compared to whites and when compared to Black populations, they have only a low risk of a negative outcome as compared to Blacks that have up to a 7 times a risk of negative outcomes. This is in Massachusetts. Now, when we look at other states, here in North Carolina, you see it looked like this. In Indiana, North Carolina, in Texas, and across the nation. And this shows you a similar pattern across the country and across states. And we could do this with Latinx and Indigenous and Asian Pacific Islanders. We could do it across cities. The result is the same pattern. Blacks always having a higher risk of a negative outcome as compared to whites. And similar is true for those other communities of color I mentioned. Here is evidence that this is not a cultural issue. This is not individual responsibility. This is a systems concern. And here we show that we are in the midst of a challenge with the advantage that whites have. So we changed the reference group and made the reference group the white population. And we show so the negative outcomes for all Blacks are just that much more positive. And here you see the advantage that white populations have. Again, that's not to say that white populations don't have negative outcomes. They do. There are white poor people. There are white people that are in jail. There are white people that have their children taken away from in terms of custody. There are white people that get diabetes and other negative health outcomes and are unemployed and have poverty and all kinds of things. But in comparison, because of the structural nature and history of our country, whites are consistently advantaged, and those Black, the hardest negative outcomes, and lighter, the more whiter, the less negative outcomes. And to explain that this is something that we all deal with, these are all highly effective countries across the world. And this is measuring life expectancy at birth for many peer countries, including the United States. The green line is United States, just white people. So with taking out, accounting for racism that is, some might say, affecting only people of color, we've taken that out. Look how far we are behind the majority of other peer countries when it comes to life expectancy at birth. We add in people of color in this bar two slots back, and it doesn't change much. So this is, again, evidence that this is harming everybody in this country. And just one other example, infant mortality per 1,000 lives births. Infant mortality is somewhat our canary in the coal mine across countries. Our infants are our most vulnerable population. You see, through all our peer countries, infant mortality is one of the worst in the United States, just with white people, 2 people back. You see, we only have 2 other countries behind us with a worse infant mortality rate. So again, everybody is being harmed by racism. I just want to bring in very briefly the idea of intersectionality. We recognize there are all kinds of ways that we identify by race, by ethnicity, by class and gender, language, religion, abilities, sexuality, mental health, age, education, and so forth. And that according to intersectionality, we can have more or less power depending on what our role is at a time. How if I'm in a room full of Black people, I may, with one white person, I may have a little bit of advantage compared to that white person. But if I'm, like most of my time, in largely a room with mostly white people, I have a disadvantage just because of race, because of my ethnicity. Maybe if it's just all men, I'm less in challenge. But if I'm in front of white women, for example, as a nurse, that was a challenge. I had less agency in some ways, and to a degree, different agency as a man compared to a woman. So we have layers, as Kimberly Crenshaw, who coined this phrase, has talked about this, and they can compound themselves in the harm of that. And so that just brings a whole dynamic, a different dynamic to that area of race and structural racism. And then finally, this wheel of power, and it talks about privilege that comes with that. And we can talk about citizenship and gender and language and wealth and housing, body size, mental health, neurodiversity and sexuality and ability, education and skin color. All these things have a different agency and level of power or privilege or lack thereof on either accounts, depending on where we are. And the closer we are to certain powers, if I was cisgender, I may have less power than cisgender more power than I might be if I am a non-binary, transgender, intersexual person. Or if I'm rich compared to poor, or I'm slim compared to big or fat, or if I'm heterosexual versus lesbian, there's where the power and privilege can be fluid depending on what environment we're living in. So I'm going to stop my slide there and wrap this up and invite Cameron to bring this to a whole different level in this conversation.
Dr. Andre, thank you for giving us all the overarching ways in which structural and systemic racism exists. And the conversation is needed. As we focus towards and gear towards focus on that pond, that healthcare pond that you mentioned so well, it is widely known, of course, that health is wealth. While this conversation, as you've said, may be uncomfortable, but also welcoming to others, I think we must all agree that the healthcare delivery system under the climate that we're in needs improvement. In order to get to where we need to be, where we need to be to grow, we do need to discuss the pain, and I think you did an excellent job at explaining the pain and the reflection piece of it, because pain plus reflection is what gives us growth. It's been long pursued, as you know, by policymakers, practitioners, healthcare stakeholders, to improve the overall population health. That's a conversation that's being had day in and day out with policymakers, health plan carriers. How do we improve population health? In order to achieve this critical task, we must create best practice. I like to say, let's make some pies. And by pies, I mean, let's create policies, implement those policies, execute those policies by using sound strategies. By doing that, that is the only way that we can reduce and eliminate differeces in the health-based outcome of our community on a community level, on a racial level, on a socio-economic level, and other social factors. It is so important that we do this, because if not, here we are still faced with health disparities within the Black and Brown community. My first questions off to you is, as most healthcare system and organization are addressing and creating strategies around quality, access, and affordability, you hear a lot of those jargons being thrown around. And as you know, you hear me coin the phrase pies, right? In your role as a healthcare provider, how have you seen systemic racism policies impact the Black and Brown communities?
It's a great question, Cameron. The challenge is that, so you think of a game of Monopoly. Those that created the systems on healthcare, the systems in insurance, in banking and housing, in the criminal justice system, all of them were populated, led, and built by white populations. Because of where we started, how we got to this country, how many centuries we were disempowered in broad spectrums of ways, slowly but surely we gained some level of enfranchisement, but slowly but surely only began to get into the schools, be trained in the disciplines, find access to resources to be able to gain broad spectrums of expertise, to build our own schools, hospitals, become broad spectrums of professionals, work in the workforce, and be able to gain access to resources to be able to have our children move forward in all those different ways. So we're getting to the starting line way late. So if we were playing Monopoly, people have bought up all the property, built the banks and hospitals, brought workers into those hospitals. All the people at the table, all the people making the money and getting the power were white people for centuries. That timeline that you saw brought that all the way up. It's only recently, within our parents, grandparents, and maybe great-grandparents' time, that we've seen a growing group of people that had the capacity and the willingness to let those people with those skill sets to be at the table. We are still at the minority of leadership. I mentioned in my talk that I became a bureau director, only the second bureau director in a bureau that was part of the original colonies. 400 years before we got someone that looked like me to lead a bureau, second in line to the commissioner. And that's reflective of people in hospitals, in all those other things. So how can we expect that our perspective, our experience, our expertise is being integrated? It's only now. So it has been a dominated engagement of white engagers that hadn't even seen us until just recently. So we're behind and we're still catching up. And society tends to frame that as that we just didn't work hard enough. That's not the truth. We have to remember that.
And you know, and that point that you raised really resonate with me. My son, 27 years old, graduated Syracuse pre-med, true story. And he worked in the ER because he wanted to figure out some experience as a PCT, what level of specialty he wants to go in. Great point. And recently he applied for medical school, and believe it or not, in the PA program, he's the first Black candidate. And here we are in 2023. So all of that resonates with me personally. And for me, being in the healthcare profession from the healthcare standpoint, regulatory standpoint, working with the health plans, I care so much about the population health for the consumers. That's where my drive for healthcare. I've sat across the table from individuals in their home. That's how I started my career. And I understand, I've seen individuals where in order to get medicine, it means bypassing buying groceries, right? And instead of getting better, they're getting sicker because, one, they're not getting the same care or seeing a physician that may understand what they're living, what they're walking through. So to that point, that's a complete personal touch point for me, what you just mentioned. And it has to change. How do we change that?
Yeah. So, you know, and it's important to acknowledge that personal is universal, right? Across our communities of color and across broad spectrums of intersectionality, that is the experience and the generational experience of that for many, many of our community members. You know, the kind of markedness for decades and to a degree centuries, we had white schools only. Then we had white schools and Black schools. And then we had schools and we had colleges and Black colleges. We had hospitals and Black hospitals. We had doctors and Black doctors. That you see the markedness? Right. That means that somehow those things were less than. They came later. The standards are those unmarked things, and the marked ones were somehow less than. And we, in this morning's paper, we read that new research that showed that those people of color, particularly Black people that were on death's door, dying of cancer, routinely got less pain medication than those dying that were white. And when they got pain medicine, they got lower doses than their white counterparts. This is because of us not being at the table for centuries. And now most of our research has been done on white populations and doesn't reflect the communities that are part of the drug development, all other kinds of development.
Do you think that there should be more community organizations within the Black and Brown community to really educate the community residents of what their rights are? And I'm sure that we see a lot of it with this platform, with the Schenectady coalitions. We've seen it with the Schenectady County Human Rights Commissions. I think if it's more localized, you know, and having monthly meetings to really let the community and really get the community out, that it has to start there, right? Which brings me to the other piece. You hear the new jargon, social determinant of health, right? And for those that are listening, it's a non-medical factor that influence, I should say, health outcome. Dr. Andre, do you believe that the social determinant of health can help achieve health equity for people of color? And if so, what is needed to turn policies into practical, intentional results?
That's a great question, Cameron. The social determinants of health are all the things around each one of our lives, where we live, where we play, where we learn, where we pray, our zip code, in large part, determines our health. If we're in a place without sidewalks, if we're in a place with significant particulate matter from smokestacks that are polluting our air, if we're in a house that is infested with roaches and therefore making asthma that much more of a challenge, we're starting well beyond the starting line of someone that lives in an environment with sidewalks, with safety, without cockroaches and other vermin, and able to live and breathe air without concern about taking in poisonous chemicals. And so we, unlike most other developed countries across the world, we spend the least amount on that social determinants of health, where people live, how well their environment is, whether there's a park in their community, whether they can safely walk in their environment, whether they have a house that is warm or has air conditioning in the midst of the heat. We don't spend that time. That's all individuals' responsibility, where it makes up 90% of our health matter. We focus almost all of our resources, 85 plus of our resources in this country, on a sick care market. And so the way we can change that is to continue to show the overwhelming data of what the social determinants of health, what our environment does for our health, and invest in kind of environmental strategies that make the healthy choice the easy choice. As an example, the Massachusetts, and this is seen in other states as well, has what we call Mass in Motion, where we've created policy where we help local cities and towns build those healthy environments, like clean, safe parks, sidewalks that everybody can walk on, streets that aren't overrun with cars and can allow a bike to safely ride, to have lighting that's sufficient so that we don't worry about being out at night, and all kinds of different things that make easy access to produce. Those things, when they're ubiquitous, when they're easy for everyone, no matter where you live, to access, then you have a better chance of, without working hard, making good, healthy choices. It is, we call it individual responsibility, but we've systematized it where we don't have if you only live near a bodega that doesn't have produce and only has processed foods, you don't have the same opportunity that someone has a grocery store next to them.
I'm going to touch a point because I'm sure that someone out there is thinking it. Now we're going through gentrification, and you talked about the zip code. And with gentrification, you notice that one block is in perfect order, and the next block, they share the same zip code. From your standpoint and your experience working in a hospital setting, here we have the zip code. We have a white counterpart. We have the people of Black and Brown community entering that same hospital. How do you address that zip code point? Where is the health disparity for whites and Black and Brown people sharing the same zip code? Have you seen a change in the care provided?
In the care provided and in the
hospital setting, or just, yes.
And in the outcome. So I'm right across the street from Boston Medical Center, where I've spent 14 years as a nurse there, serving the poorest of the poor in our local and statewide community. We had made it our mission to make sure that we gave exceptional care without exception. That's the motto of the Boston Medical Center, then Boston City Hospital. And even when we gave exceptional care, we would be giving care to someone that has asthma, that someone has diabetes, that someone that was dealing with broad spectrums of physical orthopedic injuries, with maternal and child health issues, a broad spectrum of concern. We could give them all the care to solve that immediate acute issue and send them back to an environment that caused the issues in itself. So and that's not to say, especially back then, that there weren't differences in care depending on who you were.
Mhm.
I about 10 years ago, broke my arm and went to a hospital, and my white wife had to jump and shout to make sure I got the pain medication I got. And I told them I was a nurse. So I'm part of the system. And it took that voice without, I tried to advocate for myself. It took that voice and that was a nurse of color that was caring for her. So that bias is baked into the system. We're all swimming in the same poisonous groundwater. And so, and the challenge is that every hospital thinks that issue isn't theirs. We do it right. We know that at this time, in 2023, you can be a Black woman with a PhD and you have a higher risk of maternal mortality and morbidity than a woman without a white woman without a high school diploma in 2023. And that's just as much true in Massachusetts as it is in Schenectady or in Mississippi.
So again, the SDH, social determinant of health, is a big piece. But besides that, what other policies and change agents are needed to create better policies that will drive the results you hope to see, that will meet the triple aim for the Black and brown community?
I think we need to make sure that we create systems and practices that encourage a multicultural leadership at the table. Mm-hmm. Again, we need to mitigate that late to the game because the system wouldn't let us in the game kind of issue. So make sure we're encouraging and promoting multicultural workforces that meet the multicultural need of today. We need to go ahead.
No, go ahead.
We need to make sure that we have checklists for care to make sure that we can bring a quality assurance element that mitigates the unconscious bias that's baked into the system. As I mentioned, every hospital thinks that they do OBGYN care perfectly well, and yet across our system, we see that disparity of maternal mortality and morbidity as well as infant mortality. So create checklists that allow for a more objective version of how that we make sure we can deliver consistent, less biased care in all kinds of ways.
So you would agree that the lack of diversity of Black and brown healthcare executive and senior management seat at the table is impacting the health inequity in our communities?
It is undeniable. There is more than enough research that shows that. I mentioned the one that was in the paper today. It happens over and over again. That was in cancer end of life care, but we see it in every single element of every single disease across every single population of color.
And you know what, Dr. Andrade, I want to read a quote, and I'm happy to hear you say this because I had this quote written. Dawn Morton Reyes, who is the CEO of the National Commission on Certification of Physician Assistants, stated, and this is quote, "There are so few ethnic and racial minorities around the table when they're making decisions on what type of healthcare services we are providing. Also, who is providing those services? What will enhance and inhibit utilization, that the policies that comes from those decisions don't necessarily reflect the community at large." In addition to that, about the seat at the table, Modern Health stated that when they did a survey on the 20 largest health system, they found the median percentage of senior managers who comes from a racial or ethnic background to be only 20%, with roughly 80% of the remaining managers are white. How do you feel about that, with what we're faced with correcting this large task of population health? As you know, the Medicare population is growing. We have a larger population behind that. Right now, we have individuals where, for myself, I have children that are grown and I have my parents aging in, right? So now, and we also are changing because we're getting older, right? And we have all these shifting happening around us. And us, like you said, being into healthcare, to have your white wife have to be your advocate after speaking up and saying, I am a nurse, fell on deaf ear. How do we change that? How do we change that? Where do you think it's no longer about policies. Policies is one thing. How do we get the pie into this?
Yeah. So it is the age-old question, and we are learning more. So it is, again, a broad spectrum of systems approaches. We have to start with our educational system. We have a long legacy of students, young children of color, the promise of our future, discouraged by broad spectrums of our education system saying, no, you shouldn't go there, you can't do that, right? We need to make sure that we are building multicultural schools that allow for everyone to shine in the way that they can, and not, we are still expelling kindergarten kids of color more than we are expelling white children. So there is still a bias there. We need to find ways to mitigate that. We need to share these untold history. We have to acknowledge the kind of pushback we're getting right now, the resistance towards telling this untold story, that worrying about the discomfort of our white community members over the understanding that this is baked into our system and unconscious. So we make sure our schools are being as inclusive and dedicated to everybody in the most equitable way. We find ways to get more students able to kind of think about what they want to be and how they can be all that they can be, and give them those better opportunities, and then find ways to move through this. In large part, we'll be doing this by attrition because our new generation don't have the baggage that our generation is dealing with and is ready to move to that multicultural system. And they're still being pulled down by the legacy that we have doing that, but it's by making sure with education in every single system is finding ways to recruit, retain, and promote broad spectrums of community, because we know when we have a multicultural decision-making team at the table, we make better decisions at the table and everybody wins.
And it's funny that you mentioned that, because I think that in addition to that, education most times begins at home. I think that if we can go out and educate, arm the residents with knowledge is power, right? And I think that I come from a background where it's a village mentality. I believe that iron sharpens iron and no man should be left behind. And I think what you're doing out there is great work. I think what the Schenectady Human Rights Commission is doing is great work. And we have to have these uncomfortable conversation, the pain. We have to have the reflection piece of where we have been and tell the truth and speak the truth to where we have been and the system that was not set up for us, so that we can grow as a community, or just grow not just for the minority Black and Brown community, but for a community that is all inclusive.
I hear and just embrace everything you just said, Cameron. I want to just add one thing. So education is a critical element, and and policy change is a critical element, but we recognize Brown versus Board of Education, supposedly opened those doors, right? But it took a generations to move past that. So it is changing culture as well. We see after George Floyd's murder and the almost 3 years of COVID that we've been doing, that help highlight what many communities, particularly white communities, didn't see in terms of the broken system and the racism and the kind of structural element of it that is so pervasive. We need to make sure that we bring a coalition of multicultural people that go through that intersectionality that I bring, those that are disabled, those that are queer communities and LGBTQ, yes, transgender, immigrant communities, English as a second language, broad spectrums of religion and faith. All those people have to come together as allies to work together to recognize the only way we're going to make a difference is that if we change the culture that aligns with better policy that makes more people able to be in the world and part of the world to make it a better world.
I concur with everything you have just said. And Dr. Andre, I just want to thank you for your time. We can carry on this conversation forever, as you can see. And my thing is, I've always said constantly, policies without execution and sound strategies get us nowhere. So I concur. Thank you for your time, for taking the time to just have this great conversation. I don't know if Arthur is on, that he can see us.
My pleasure. Thank you for having me. Again, here is, and I know we've talked and shared that we would be back here and sometime soon. I'm helping to be part of that. And this is a deep conversation, and I'm so grateful to have it with you all and to bring this to your community.
Thank you.
Thank you both. Can you both hear me?
Yes.
Okay. Wow. What a great, crucial conversation. And all of the points that you touched upon, and I really appreciate checking in with our viewers and those who will come back and view these clips to make sure they find a safe space to check in with themselves when we're dealing with conversations that are necessary to be had. I remember reading a quote of Derek Bell, and Derek, in this quote, Professor Bell said, "It appears that our worst fears have been realized, that we have made progress in almost everything, yet nothing has changed." Yeah. And, you know, for us who has lived a life where we have watched progress be made and still be left with this overarching feeling that nothing has changed. What do we do? What do we do? You know, my pastor once said in a prayer, she asked the question, what do you do when you get down on your knees depressed and you pray only to get up and still be depressed? What do you do when you ask for help and there's no help? What do you do when you need a friend or you need an advocate and you have wore your voice out from and been worn out from advocating so much and having to remind people that you belong and that I bleed the same color that you bleed, and that some of the original things that were written on paper that talked about human rights, how we address the fact that we have seen some as human and others as inhumane. So, were you going to say something?
No, just that, this is, I think the biggest, one of the answers to what you've just quoted and raised is that we have to remember we are not alone. We can't do this by ourselves. And in the midst of not being alone, we also are enough. We can't let someone take over our identity and our value. We have value. Society will try to help us forget that. We never forget that, and we know that we're not alone. And that beloved community will come. We have to bring a kind of radical, critical eye to the world and recognize that it is not the world we want, but we can make the world we want if we don't give up and we keep on moving forward. We have to hold accountability strong, and we need to fight for it. It's always been the way.
Thank you.
And you know what, Arthur, you mentioned what your pastor said about faith. And, the Bible says faith without work is dead. To Dr. Andre's point is that we can have those conversations, we can have faith, but the work piece of it has to come into play. And to his point, we cannot give up. Our voice has to be heard, but then we have to, you're going to hear me say it a million times, implement, execution.
Yeah.
There are more of us than there are less.
In the spirit of Martin Luther King and Malcolm X and Black Lives Matter, we bring Black dignity forward when we stand up and stand forward for what we deserve. We have to fight for it. This country is not going to give us anything unless we fight for it. We have made progress, and we have more and more people that is multicultural people coming together that is saying Black Lives Matter. You see less of those signs on the lawns, but they're still there.
Yes.
They weren't there before.
Yeah. All forms of inequality, injustice, and as it relates to all forms of life, Dr. King said, is most shocking and inhumane. So thank you both. We will come back together in a month to have further conversations. Dr. Andre, we're going to make sure that whenever we come back, that we work it around your time and your schedule. This is a key element that Chairman insisted on having when asked to be our mistress of ceremonies. She said that, of course, as educators, because we're all educators, she said it is important that we add this additional piece in so that when we come back, we will have a format where people can ask questions. For those who have watched today, there will be a form on the website where you can fill out in its entirety with your name, or you can remain anonymous, but you can ask the questions so that when we come back in February, we can answer those questions. We can pick up the conversations. We'll have a chat format where people can in real time ask us those questions and get those answers. That'll be the deeper dive. That's the commitment from the three of us to you who are tuning in, and the commitment of the Schenectady County Human Rights Commission, so that we can educate, inform, and make a difference in the world that we live. Thank you, and thank you for tuning in.
Oh,
Thank you.
my pleasure. Thank you. Happy Martin Luther King Day, everybody.
Happy Martin Luther King. Thanks for joining us.
Hi, everybody. My name is Paulette Lund, and I'm very proud to be a part of the Martin Luther King celebration that we have going on here. I wrote a selection called Celebrate Us because I think that for what Dr. Martin Luther King accomplished and all that he did, I think that one of the most important things that he stressed is that we as people have to celebrate ourselves, but not only because we're happy. We have to remember where we came from and where it is that we want to go. Somebody said that in order to celebrate, you need to remember where you came from, how the bends and the sways of the rocky way made your victory so sweet. And somebody said that in order to celebrate us, we need to remember them. The faith-filled throng that led the way with whippings and chains and voiceless cries. They walked for glory and they sang for peace because they were the baritones for freedom. The baritones for freedom in a time that was swollen with rage. Rage against the people who were cleaning up their houses and washing their clothes and feeding their children and wiping their noses when they could barely wipe their own. Now, somebody said that in order to celebrate us, we need to climb down and then look up. never forgetting that the God who kept us and brought us through is still on our side, and not with a residue, but with the strength and the clarity that never wavers to embolden you. Now, somebody said that in order to celebrate us, that we need to look in the mirror and admire ourselves, because justice too long delayed and too long denied cannot take away our dignity and our pride, because we hold these truths to be self-evident, that where we going can't be where we went. Because you see, we have to wash off the bruises and cut down the nooses and know that he who loosens the neckties will also loosen our burdens. And somebody said that in order to celebrate us, that we have to stand united and avoid the rush. Avoid the rush to judgment, and not to impale our hopes and our wishes on those who have nothing but brushes to cast us aside and dismantle our dreams. And somebody said that in order to celebrate, that we have to deal with the rate of misinformation and disinformation and wrongful incarceration, and bringing up your children right in a dented nation that has cemented you as needy. And somebody told me that in order to celebrate us, remembering the why we got here is the must. Now, we must remember our ancestors who got a whiff of freedom, but were never allowed to breathe the air. So don't sit up in your armchair talking about what you do and don't believe. All of those conspiracies that muzzle you and drop you to your knees. Because the poet said, weary the road we trod. And I don't know about you. But I am emblazoned and emboldened and encouraged and emphatic. Because you see, I don't just keep my eyes on the prize. I lift my eyes to God. And on this celebration of Martin Luther King Jr., I request that you do the same.
I hope you enjoyed what we presented for you today. What a great conversation. I enjoyed spending time with you. I enjoyed learning and listening. And as Paulette told us in her piece, to celebrate, I want to leave you with that thought. There's a party going on right here, a celebration to last throughout the years. So bring your good times and your laughter too, and come on and celebrate 2023 with us here at the Schenectady County Human Rights Commission.